Being organized in the clinical exam or in your real practice is very, very important. Many students waste their valuable time in the clinical exam purely by not being organized. I teach a step by step approach where you take history in multiple layers, you have transition statements, and you move on to examination and you think about the most important things first, then the other things. Then there is a transition into investigations and then a transition into management. In the management, there are things you do in the first 30 seconds, next 30 seconds, and before the bell rings. So it is very, very important you are organized. And I use the same approach, same structure for all the OSCE cases. And this is what made me pass all my 16 stations in my OSCE in the first attempt because I had structured approach. I was organized. I know how to start the patient scenario, how to take history, and what is the first thing I do in history, what is the second thing I do in history. I divided this into 4 layers of history taking, and that's the heart of passing the clinical exam. So when you are organized, when you think in a structured approach, when you have frameworks, tactics are things that are helpful for each and every scenario. I have one approach, I just change the tactics, the principles are the same. So if you would like to know all these structured approaches, tactics and frameworks I use, make sure you look for a under this video or link in the bio, and I will teach you some of the strategies that will help you save time, not miss a diagnosis, pass your clinical exam, and be a confident clinician. If you would like to know more, click the link and I will see you inside that video.